started. Thank you so much for joining us today for this OpEx webinar. My name is Mia Pritz, and I've been working with Opportunities Exchange, which is a dream come true, for about the last year and a half in a formal consulting capacity. And I've known OpEx and a lot of you for a very long time, dating back to about 2009. So I'm thrilled to be working in this capacity and helping support the work you do to help support childcare providers and educators and families, and especially young children. And today's topic is the new CCMS Toolkit that we've recently launched and released. And I organized a lot of the toolkit and compiled resources that we've been gathering and sharing. And so I'm going to walk us through what it is and why. And to help support that, I have basically a PowerPoint to guide us, but I'm going to be jumping in and out of the toolkit itself. So I'm going to go ahead and share my screen, and hopefully you can see it. And I'm going to go into slideshow mode and we will get started. So can anyone just share with me in chat or out loud if they can see just my title page?
Yep.
Perfect. Thank you. So this is a webinar about the CCMS toolkit. The 10,000-foot view of like why we have, created these resources and why we share learnings is it's several-fold. One, the drumbeat of childcare is in crisis continues. We on this call all know that this is not a new since COVID issue, but that COVID exacerbated it, and that the field has gotten a lot of good visibility and attention on the crisis of childcare. We also know that there needs to be a really clear line of sight for stakeholders and policymakers into the state of the business of childcare. And we also know that we really critically need a pipeline of new providers. And so it's hard to get a new pipeline of providers if the only news on the street is that childcare is so broken. And it's hard to get stakeholder and funding buy-in if there isn't a clear line of sight into how businesses are functioning. So to get us started, I would love to do a little visualization exercise, because part of the sort of theory of change that I've been working on with my colleagues at OpEx is the view from the provider. So imagine that you're a childcare business owner. You can imagine that you're a center director or a family childcare provider, and you go through the licensing process. So that involves at least one system, possibly more. And then you go through starting to contract with your state subsidy agency so you can help support families in need. That's a whole nother system and process and paperwork required. You decide to participate in the Child and Adult Care Food Program. That's another system, another agency, another set of rules, another process. And if you're a family child care provider, it's for sure another system of tools to use for reporting. You're hiring staff, so there's staff management, different systems to hire and maintain and track professional development. You are enrolling families, so there's marketing systems to develop and use. There's a state child care finder. There might be local child care finders. There might be a statewide pre-K child care finder, but the bottom line is there's multiple systems there that you're engaging with as the provider. There is QRIS and state pre-K systems. Sometimes joined, but oftentimes operating in silos. And there are also things like tax reporting and, you're enrolling families. So there are enrollment forms and immunization records and tuition and tuition payments and expenses and all these different things that are requiring all these different systems for you to use. And so that's a lot. And we know from talking to providers that they really want systems to be streamlined. And it seems like that's a pretty fair ask. So hopefully in your visualization with me, you're feeling a little bit uncomfortable right now. Just think about how many apps that is, think about how many logins that is, think about how many different deadlines and due dates there are, and all these different things you have to juggle. And it's the same whether you're caring for a handful of children, say 6 children in a small family childcare home, or a really large center with hundreds of children. The requirements are effectively the same in terms of business operations. Now that we're all uncomfortable, CCMS is a really natural entry point in streamlining these different systems and processes. And so we created the toolkit so that we could compile all of these really rich lessons that we've learned and the compilation of best practices as we learn and understand them. And I really want to make sure to be clear that we're always evolving what we know and what we don't know, and how we learn what we don't know and how we apply it. And so please expect to always see resources from OpEx iterated on over and over again as we learn more and are able to do better. And so just keep that in mind, and that will come up a little bit, during today's webinar as well. And then if I could just encourage you to keep the experience of the provider and the educator at the forefront of your mind through this. I think that using that as a common grounding point is really beneficial to all of our work with families and with childcare business owners. So the resource itself lives on the OpEx website, which is www.opex.org. And there is a tab at the top that says resources, and then you can click on CCMS Toolkit. And I also gave you the cheat sheet link directly to it here. And I'm going to be going into some of the different documents that we've compiled to show them to you, but I'm not going to go into all of them because I don't think it's helpful to try to read content to people. More, I want to orient you and really talk about the why behind these different strategies and recommendations and get people's feedback on how they have or haven't worked in their real life experience. Also want to say thank you for everyone who indicated where they are in the process of implementing CCMS, whether it's something they are considering or curious about or helping support through being a child care advocate or support agency or state agency. If you're a vendor who's always trying to help make this all easier for the field, thank you everyone for sharing your experience. It's a really nice group that we have today with all sorts of different entry points. So the beginning of the CCMS toolkit is about grounding in the what and the why. And so part of what we've done is compiled a list of definitions. And I guess the first definition I should start out with is, what is CCMS? What does that even stand for? And that stands for Child Care Management Software. It is a typically web-based or cloud-based application, meaning a tool that was built to support the business needs of people running and operating childcare programs. Most CCMS systems on the market have a lot of similar functionality, and some have some unique pieces, whether they focus on the experience for family childcare providers or have additional module options around, things like payroll or expense tracking. And so doing research is really helpful, and we have some guidelines and guidance for you along this. But basically, some of the definitions, I'm going to click into the toolkit now, and hopefully you can still see my screen, but you'll be able to click into here. And we're trying to define what we mean by all these different terms and definitions and abbreviations, et cetera. So this can be expanded on, and we're actually planning to expand on it with another article on what the difference is between an operational data store or ODS or data lake and what an ECIDS, an early childhood interactive data system, what the difference is between those, because that's big, but that's a little bit outside of the CCMS conversation today. So you can use this document to orient yourself. And if you do ever have feedback on what the content that we're sharing contains and ways to improve it, I will gladly take that feedback. Anyone on the OpEx team will, all the time. So please keep it coming. And the reason that definitions are important is because I've discovered over time, we might think we're talking about the same thing and we're using the same words, but in actuality, when we go down to define it, we're speaking about different things. And so we want to make sure that we're using a common language and shared definitions. It helps us move towards our goals in a lot more streamlined way. So this is one of the things I'm not going to read to you. There's also a whole series of value propositions for providers. And the reason this is important is that the why behind all of this is critical. Changing how you've done something for 1 year, 5 years, 20 years, 30 years is a big deal. It's change management, it's theory of change, it's behavior management. There are a lot of psychological aspects behind it. And so why we do all this matters very much, and why providers should participate and why we encourage them to participate matters very much. And so having, again, a shared understanding of the why behind all of this, a shared definition, is a really critical piece to getting people interested and understanding why they keep going, even if it might feel uncomfortable to learn new habits and routines. And it's totally normal for it to feel uncomfortable, and we can continue moving forward nonetheless. Two things can be true at the same time. So this is a long set of resources on how CCMS can interact with all different aspects of running a childcare program. And then we have an additional tool that is for coaches. And I know there are a lot of business coaches on the call today as well, which I really appreciate. And what we want to help highlight to you is how you can use the data gleaned from CCMS to help you understand where the providers that you're working with are falling in terms of getting onboarded to the system, different modules and functionality they use, why they're using it, what actions you can take as the coach based on the insights that are surfaced to you, and how you can help them move forward in strengthening their business. So these are just some different views of pieces of data and activation that CCMS systems can surface. And know that each vendor has their own version of dashboards, and they're constantly evolving. The vendors do amazing work on hearing feedback, hearing the end user experience, whether it's providers or coaches or stakeholders or state childcare administrators, and making that feedback really reflected in the tools that they're creating. So in addition to sharing feedback with OpEx, because we can help quantify that and share with vendors when we're hearing multiple requests across different areas, you should always feel comfortable doing that too. And consider that when you're in partnership with a vendor, the end goal is to make this a better process and system for everyone. And so constant feedback is a really important piece of that. For state administrators, state childcare administrators, different agency heads, et cetera, CCMS already contains a ton of the information that's needed. And so Louise wrote a really impactful article on implementation of the new CCDF rules and how modern technology can help. If you read this article, there are some really key recommendations, not only on CCMS, but also on different pieces of like eligibility, attendance tracking, state childcare finders, et cetera. And just know that CCMS as an entry point can concretely support the system changes that everyone is working on making right now in alignment with the new CCDF rules. And then how do we get started? So let's say that you're a stakeholder of some sort. Maybe you are working for a CCRNR or another type of agency supporting providers, or the state early childhood office or human services or Department of Ed, all these different approaches and groups to supporting the business of childcare. And you decide that you do want to potentially start a CCMS program where you get providers access to tools and you help support their use of those tools. And then you use the data and insights that come from that use to inform your next steps and ongoing policy. So where do you start? Well, obviously you would start with reading through the CCMS toolkit. But you really want to start in your own community. You want to survey providers and ask them about their current needs and their experiences and things that are hard and things that are going well, different resources and tools that they use. And really use that as a starting point to describe the why you are starting an initiative like this or researching an initiative like this. And really the why, in my mind, and I'm sure there are many multiple layers of why, and it would be great to gather some additional ones from people on the call, but for all we know about the business of childcare, there's still so much concretely that we don't know in a manner that allows us to accurately report on. And so that requires, again, that line of sight into business operations. And providers sometimes think, oh, they want to see my books, they want to see my ratios. And to me, it doesn't mean that at all. CCMS shouldn't be used as a regulatory trap, but it should be used to provide that insight into how childcare programs are doing. How fully enrolled are they or aren't they? Do they have an overabundance of preschool and pre-K slots? Are they waitlisting infants and toddlers? Are they fully full? Are they 20% full? Do they have parent demand, but they can't meet that demand because they can't hire enough teachers to be fully operational? Are they amassing a lot of bad debt because families aren't paying tuition on time? Do they have delays in subsidy or other reimbursement claims or processes? Are they breaking even? Are they running at a loss? You can get insight to all those different pieces without having to access an individual program's books. And that's the beauty of working with the vendors who can help surface that information to you. And basically, the way I think about it is we don't ask any other business or industry to run at a loss at the favor of the customer. But in childcare, we do. We know that parents can't afford to pay the true cost of offering high quality, but we don't expect anyone to step in and help fund the gap between what it costs concretely to offer a high quality program and what the market can bear. And we expect the providers to take on that burden. And that results in low wages, low benefits, high burnout rate. And we have a very much aging workforce that we need to be replacing. And so we need to be able to show concretely to policymakers and lawmakers what that gap is. And the best way to do it is through use of consistent tools that can surface consistent data and reporting. So the why is more than like, you can save time by not printing attendance sheets for parents to sign. That's very true. And for a provider, the cost of learning a new system might not be worth the benefit in their mind, but there's a bigger benefit that they're participating in and that the collective effort helps inform. And also just, I feel like it's always important to say, like, we want to do things with providers, not to them. And so asking them about their needs and experiences is a really important piece of getting buy-in, which I'm sure that's preaching to the choir, but I figure it's worth saying. Okay. So how you go about selecting a childcare management system or systems, we have a section of the toolkit that goes through that. So for platform selection, there are some different documents that can help you think through considerations for both center-based programs and family childcare homes. And there are some different considerations. One is that family childcare programs need to do a space time percentage calculation for their taxes. Another is that center-based programs don't have to use a food program sponsor, and so they could use CACFP tools built into CCMS, but a family childcare provider might not be able to do that. And so looking for tools that meet the needs of everyone is really important. And one thing I can tell you with certainty is that in all of our combined experience at APEX, we've found that offering multiple choices and options for providers to select from when you're funding CCMS licenses results in stronger participation, deeper engagement, and overall higher levels of satisfaction because people like to have a choice in what they're doing. And so while it might make sense to start a pilot with one vendor or one product, it does make sense over time to add in more options for providers who are the experts of their own business to be able to fit, use the tool that best fits their needs. So provider type is a consideration. Considerations for current or future interoperability. So that goes back to the definitions document, but interoperability means instead of systems where you log in here to do this, and then you log in here to also do this, but two more things, the systems work together so that the end user, which could be a provider, could be a coach, it could be a caseworker, they're going to one place to do the things and the data is flowing back and forth. And so a lot of CCMS platforms offer some type of connection right now, which can be a low lift into state systems or reporting requirements. And they can go deeper to, automate and streamline and build code around it. So there are a lot of options that all the vendors can do or could do if they had the resources to build them. And so thinking about, again, the experience of the provider and more of the 10,000-foot view, like what's our end goal? Is it to continue making individual systems people have to use, or is it to behind the scenes blend systems as much as possible so that people have to do fewer things in multiple places? And then again, just strongly considering optionality for providers. So this is a link to provider selection. I linked to the tool for thinking about choosing a childcare management system for home-based providers. And there's a separate document that looks very similar to this for center-based programs. And the reason we have two separate ones is that there are different tax reporting requirements for home-based programs versus centers, receipt management, time tracking, and food program participation. And so just to show you high level, like this document talks about what the thing is, what the functionality is, why it matters for shared services or large-scale CCMS implementation, things to think about, and questions you could ask the vendor if you were getting a demo and better understanding a particular project. Another piece that we've been working on that it's probably out of date right now. It was updated in November. We have put together a document of states engaged in expanding access to providers using CCMS. And I would love for everyone to click on this document from the toolkit and scan it and let me know any feedback or updates you have. And this is talking about CCMS specifically. We've started linking business coaching tied to CCMS to the document, but we would also love, and I think everyone would love, to expand on it to include other pieces of information as well, like around state child care finders and eligibility platforms and subsidy system updates as the new CCDF rules progress, et cetera. So this resource is meant to help you as a potential or currently implementing CCMS in your community person to see where other people are doing similar work, how they're funding it. And, if you want to reach out to someone on this list to learn more about their work, we're really happy to help you make those connections. Okay, so once you've selected your CCMS platform, well, these two slides could be reverse order depending on your procurement process. You might be able to make the selection yourself and then go out and make the purchase. You might have to go through a procurement process. And so in this section, we've demystified some of the pathways. So this outlines the difference between RFA, RFI, RFQ, RFP. And we have created an outline for a CCMS RFP. And the reason I have asterisks here is that like I've mentioned, we are constantly updating our tools and resources. And our friend Tammy Foley from Iowa made some recommendations on strengthening the RFP outline, specifically in the data sharing and security sections. And so we're working on making those updates. And so I wanted to share that as an example of really helpful feedback that she shared based on her experience going through this process that should make your process, if you're a new friend in this arena, that much easier. And then RFP evaluation, like once you've written your RFP and collected responses, how do you go through and evaluate? And one of the main points that I think is important to consider here is partnership with the vendor. It might be a different type of vendor relationship that you've had previously, or than your IT org has had previously. And so we really encourage you to think through, constantly collecting feedback from providers. We know this is a big change. Anything that we try to change after doing it for years and years feels hard, even if it's the right thing to do. And so thinking about this as a partnership mindset, much like when we're working in childcare programs, we think of parents as partners, like think of your vendors as partners. And I know that they all think the same way about their relationships. And this is how we can really work together to really move the needle and move things forward. Okay, so once you have identified and purchased in that order, but maybe there's an RFP process in there as well, how do you start scaling? And so what scaling means is going from, okay, well, we bought these licenses, we bought 5 licenses or 100 licenses or 1,000 licenses. What do we do with them? And so a really important piece of this is outreach and messaging. And so whether you are a project manager of one who is working to recruit 10 providers, or you are a state childcare administrator working to build a team to do statewide implementation, it's important for your associates and stakeholders and partnering agencies to understand the efforts and how they can help support. And so we've built this document to show some of the different activities around marketing and messaging. But this is, again, like people will need repeat exposure to the why and understanding how they can participate. But it's really important for your sister agencies and your associates within your organization to also understand and buy into the why, because you'll get a lot of questions at different times, and that consistent response, this is a thing that's like for individual benefit and also for the greater good. That's really important to keep in people's forefront. And then sometimes there will be coaching efforts, business coaching and training tied to the use of CCMS. And so if that's something that you're offering, it's important to help providers understand how much they're expected to take on their own versus how much support there is. And we have a million different examples of what each of these things can look like, because we've worked with so many different orgs doing these type of implementation projects. And so again, this is something where shared knowledge and insight helps smooth the entry points for everyone. And we're happy to share and connect you with people who've done this and have learned from it and have examples to share. Linked business coaching, we've seen over time that it is a really powerful indicator of outcomes. And the reason is that providers are busy and they're doing 20 million things a day. And it's easier not to change than it is to change. But if we want different results, we have to do different things. And so business coaching can be a really powerful vehicle for this. And so my colleagues, Joanna and Amy, have done a ton of work with states and with coaches and with providers, and have written this beautiful guide on elements of success for providing business coaching. And basically, a lot of what you'll see, and you'll see over time, is really well thought out and articulated goals for CCMS usage and adoption, business coaching strategies that are tied to and aligned with those goals, and then a way to track. And so some things you'll be able to track through CCMS dashboards, some things you'll have to track separately. But a lot of the success of an initiative like this depends on having a really clear overall vision when you're starting as to what you're hoping to gain and then the pathway to get there. So this is a really good, concrete set of recommendations on different pieces of platforms that providers should be using. What will coaches do to support that? How do you track it? And then how do you know when the providers are getting there and what the outcomes are? So I'd encourage you to spend time with that. And then also, please feel free to put in questions or comments as we're going. I know this is a lot of talking and not super interactive. So I want to make sure that we have time, not just me saying words at everyone. We have some tools that we've built to help support collection of baseline data. And this is really important because in order to show the impact that is made and the outcomes, it's really important to understand where people are starting from. So how fully enrolled are they? What is their current staffed capacity for enrollment? What's their ultimate goal for enrollment? Do they understand their program's monthly revenue and expenses? Do they have bad debt? How comfortable or confident do they feel in understanding the health of their business? And you can show movement and growth over time if you collect these pieces at the onset. And then this defining full utilization of CCMS is one of the most important things I think that there is, because you have to know what you're trying to get to figure out how to measure it and articulate that to providers and coaches and stakeholders. And without knowing those things, you could go a year or 2 years and then go to measure and be like, oh, we weren't tracking this the right way. We don't know if there's been a difference from A to B and B to C. And so when you're getting started is the best time to think about this. And then constantly checking in as you're going, reporting to your internal team, to your funders, reporting with and to providers, and then the larger stakeholder base. Those are ways that we show that the interventions that we're using are working or not working, and can figure out why things might not be working, what is working, and doing more of it, et cetera. But the bottom line, I think that we all agree with, is that we're trying to help strengthen businesses. And using the Iron Triangle as a framework for that, you need to be fully enrolled, fully collecting tuition and other revenues, and understanding the cost per child is covering your expenses. Those directly relate to CCMS usage. And because we know providers might be reticent to do something new, it's really important to make sure that you have requirements in place, that providers understand what they are and why they are and how they're going to be supported in reaching them. And so this document is important for sort of identifying the framework for that. And then we have another section that talks about engagement goals, meaning in order to understand, for example, profitability or breaking even or running at a loss for providers across your group, whether it's a shared services group or a state initiative or a pilot, providers have to be using the tools consistently. And if they're not using the tools, you're going to have incomplete data, and we're going to be in the same position that we're in right now. And so ensuring outcomes requires you to require providers and coaches and stakeholders to come to an agreement on how they'll use the tools. And so I think you can probably see like the why of all of this just really needs to like flow all the time through what we're doing in our different efforts. Data dashboards. We have some templates to share with you if you're just getting started in this work, but a lot of the vendors, like I mentioned, already have dashboards in place, and sometimes they come standardized and sometimes they come with the ability to make customizations based on your reporting requirements, and that has to do with the contract you set up with them. And we have goal ranges identified for iron triangle metrics. And so what we've done is supporting data-driven leadership is a really important piece of this. So again, the why. We very regularly hear state leaders and anyone working with providers share that they don't think their providers can or will adopt technology, and that they can't require them to use different systems. And we know that providers are using more technology than we know, or that they even think, through some surveying that has been done over the last year. And an example of that is in the annual National Association for Family Childcare survey, providers self-reported that 81% of them are using some type of technology product to operate their home-based childcare business. And that was a shocking number to me. And it's because they were asked if they're using CCMS, CACFP platforms, online banking tools for, collecting payments from families, et cetera. And they also identified other tools they're using. And the vast, vast majority are accepting payments electronically from families. Whether they require it or not is a different thing, but they're using these tools now. So even when they say like, oh, I'm not a technology user, there are a lot of different ways we can show them that in fact they are. And that if we can help make those systems more streamlined so they don't have to log into Zelle and Venmo and the Cash App and take one random check payment and, we can solidify those systems with them. And that's where their life gets easier. And so we've identified some goal ranges with a product adoption, meaning the percentage of providers that you're working with who are using these different tools and modules. And we've done that with your reporting requirements in mind. So, if 8% of providers are using automated invoicing, A, people aren't streamlining their process, and B, you really have a very minimal view on what's, being invoiced, or how many families are paying on time, et cetera, et cetera. And so that's how this recommendation set was made, was thinking about really to get like that line of sight, what's needed in terms of participation. This doesn't happen overnight. I think it's worth saying that technology usage like this is a progression of steps. It's not a light switch, and that we can shorten those steps or shrink those steps by reminding providers that they already use all these different apps, and so do families, and that the stretch it's habit changing, but it's not necessarily that hard to learn. And my mom always told us we had to try something 3 times before we could decide if we liked it. And I feel like there's similar sort of frameworks you could use to encourage people to adopt new behaviors. Okay, pausing. Now, moving on to system reform, how do we link policy and finance and funding to CCMS? Well, we already know that CCMS systems collect a ton of data that's required within state systems. And so my challenge to you would be, let's move away from requiring multiple entry points, duplicate data entry, manual reporting. And then your pushback will be, but how in the world do we do that? And so we have some recommendations. I realize this slide probably hurts your eyes to look at, but one of the things that we've done with different states is crosswalks between childcare management software that they're using and things like their licensing requirements or their CACFP regulations or their QRIS system. And the reason we do that is to understand how much overlap exists right now between what a provider has to enter into state system A and what they're already entering into CCMS. And when we do that, we can identify ways that data could be transferred more seamlessly from the provider to the state. And it could be complex. It could be a full system rebuild that costs millions and millions of dollars, but it also could be dashboards or flat file reports or APIs. So there's a lot of different ways that can help streamline for providers and internal teams who are reliant on this data to do their jobs without it having to be an entire overhaul, of the state system. And this is just a sample of like what a licensing crosswalk would start out looking like. So you list, the criteria, the current functionality, anything missing, and then the recommended product updates, and then work with your vendor to figure out which pieces could be added easily, which pieces might exist and you just weren't aware, which would take, a longer build or some code to be developed or redeveloped. And another view of it is this. So this is an example of, a licensing regulation on the first row, the regulation as it pertains to centers and homes, the frequency of the data being collected, and then in this sample, one state is using 2 CCMS systems, and so we identify what exists, what's missing, and what the recommendation is for future development. And so this is something you could do on your own. This is something we could support you with, but understanding that, in one case where we did this with a state PD system, 80% of the fields that providers were entering into that system already existed within CCMS. And another big chunk of data was available that could have been reported to them through CCMS. And so just understanding it's not like, 2 things out of 1,000 are in CCMS and everything else needs to be redone. It's the literal opposite of that. And so how can we streamline? And why we care about all this, again, if this visual right here is the provider, these are all the different systems. And this is a very specific example, but all these different systems and programs that they have to touch in order just to do their job. We really want to streamline this as much as possible because this is hard to look at and much harder to live. And so going into recommendations for everyone to think about ongoing, alignment. Is the current state or the current experience that your providers go through, is that what you want for your educators and providers? It may be and it may not be. And so there may be an opportunity to align on, the future state that you're working towards. A policy alignment that's really important and should be fairly easy to resolve in the year 2025 is are all childcare programs allowed to use software to run their businesses? In some cases, centers are allowed to use things that FCCs aren't, and that doesn't make sense anymore with the tools that exist and the availability of support for using those tools. And then alignment on process. So if you're a state and you're saying we're paying for childcare management system licenses, can you also make sure that licensing will accept electronic enrollment records and that subsidy will accept electronic attendance records? We've seen multiple cases where providers switch to CCMS, but then they still have to print everything out or they're not allowed to use one component of it, and so they're having to run duplicate systems to meet compliance, and that doesn't make sense. And now I'm going to pause. We have some different scenarios within this document that can show different like small, medium, large steps to take to link systems on the back end, but that's more related to the overall early childhood technology ecosystem. But I want to pause and just get questions and feedback and see what people are feeling right now in terms of where they are with their work. If you've used any of these tools, if you have any recommendations for new friends starting this work, and just what you think in general. So please feel free to unmute and talk or put questions in the chat box. I'll stop sharing my screen for now so I can see the chat box. Any questions or thoughts? Any concerns if you're trying to do this work? Oh, nice. I'm seeing some comments come in the chat box. Thank you, Julie, for the feedback. And then Mary says our Shared Services Alliance has provided CCMS to our providers, starting with one system, and now I've added another. So they have options. Julie wants to know whose system wins the lead. That's definitely TBD still. In terms of state implementation, I think that every state has its own unique needs. And so there'll always be some customization, I guess. And in terms of technology, I think the ability for providers to choose what meets their needs is what wins, basically. Brandy says getting providers to actually use the CCMS system provided. I am guessing, Brandy, that that's like a challenge or a question you have. And I think, and would be interested to hear from others on the call their experience, but just helping people understand that it's not just about, it is certainly about making their job functions more streamlined, just like any industry is doing in, at this point in history. And it's about that greater good and visibility into how the business of childcare is actually doing. Because when we can concretely show that, we can almost like demand more attention from lawmakers. It's really hard to show that without that visibility. And it makes me think of like the ARPA funding that so many states got and that providers so desperately needed. And it's really hard to show today, like what they got out of it. And so, yes, I agree with what Tammy says. Also, business coaching with CCMS implementation is key. It makes like an accountability partner and a support system and a cheerleader. And it is a challenge. So I don't want you to think that I'm dismissing it. I just think that it's like the right challenge to undertake, even knowing that it's really hard. Any other thoughts or questions? Okay. Are there states that have had high full utilization rates of CCMS? Yes. I think that Kentucky, Iowa, and Indiana are three really good examples of that. And they all did comprehensive messaging and outreach to providers to encourage participation, and have made different accommodations so that using CCMS results in the provider having to use fewer systems overall. So an example is like subsidy attendance data can now be reported through CCMS, which means they don't have to do it in a separate system. And that's a win for everybody. And yes, Luann, I am with you. Childcare program owners are ready and state systems need to catch up. I think that with the new CCDF rules and knowing that literally every state is making some type of adjustment to their subsidy system, it's a really good time to make other adjustments and tweaks and streamlining efforts. Why not right now, since we're already working on it? Okay, I will stay on the line in case anyone wants to talk further, but we will also send the recording for this presentation and the slide deck so you can see the slides and click on the links. Hopefully you will use the toolkit and share your feedback on how we can strengthen it. And thank you so much for coming and spending time today. And our goal is to help your work and efforts be as successful as possible. So thank you, thank you, thank you for serving families and children, and reach out anytime we can help support.
I do have a question outside of CCMS.
Sure.
We are working to institute a fee structure, and I'm afraid we're going to get a lot of resistance because the program was completely free for the first, since 2017. So now, you know, do you have any tips or, what will be the more plausible fee structure? Like, I know it'll be gradual, you start off. But do you have any tips or any, information about how to do it without meeting a lot of resistance?
Yeah, that's a really good question. How many providers are you working with?
Currently, we have like 100 providers in the program. Some of them are very active. Some of them are just active as needed, when they need support.
Yep.
So I just know that we're going to receive a lot of resistance, especially with all of the program being free for so long, and then also all the other services that they've received over the, last 7 years, even through the pandemic, just getting grant money and things like that. So now it's like paying for something is like, what? You want me to pay for
Yeah.
something?
Have you been able to track any like time and dollar savings on their part?
We sent out surveys to say, have you since spent less time on administrative practices with all of the supports that we were providing? And a lot of them will say yes, and a lot of them do say that they're willing to pay, but I think saying it and doing it is two different things.
Mhm.
So, I just want to be realistic about the approach.
Yeah, definitely. Well, I think if you can negotiate bulk purchasing of licenses with, well, is this for shared services
This is
or
services in
CC?
general, just
Okay.
to include, you know, CCMS, to include cleaning, pest control, like the whole thing. We're trying to like
Yep.
give them, yeah, just to include
Yeah,
everything. It has to be a shared cost.
definitely. And I think that if you can show them the services that are included and the access to resources or cost savings or different things that they would have a hard time um,
Negotiating otherwise, like this is the rate you'll get under our program. This is what you would
yep.
pay, kind of like a cost comparison.
Yeah, like so you're showing the cost, you're showing the value of the membership,
Okay.
and that they'll continue to receive those benefits over time, and that again, it's like part of the bigger picture that the program needs to be sustained ongoing. And now that you've been able to help them realize those different savings and growth within their businesses, it's time for the organization to take in some funding from participants. And if you can offset it with, like you mentioned, you would do it over time, that might help ease people into it and make them feel like there's not like a rug being pulled out, but that the shared benefits require shared skin in the game, basically.
Right. Okay. I'm just
I
kind of
know
looking
it's
at.
a hard change, but I think that it's important too to be able to continue, um, getting those services to providers and keeping them strong.
Dawn. Okay. All right. Well, thank you.
Yeah, of course. Any other questions from anyone? Okay, I'm going to stay on for 3 more minutes in case anyone else wants to chime in with anything.
I just want to re-compliment you on the organization of this. I was part of, it's got to be 10 years now, that Race to the Top work with, the early childhood collaborative and data. And this is so much further, and just it's a fantastic like layout for how to do this and how to coordinate some of our systems and things to consider. So thank you.
Awesome. Thank you so much for that feedback. I really appreciate it. And that's great to hear.
Hello. I did have one question for you. So I did see on that one resource that you shared with us where it has like the different states and if there are any providers implementing CCMS. I noticed that ELV, so we're in Pennsylvania and we're a Shared Services Alliance. So we've adopted early learning ventures for ourselves. Now we have not like shared that out with, our 80 plus members or anything at this point. But I was curious on how ELV is in some states and not in others, and maybe what that would look like the difference as far as with us just implementing it across, our various programs and centers versus actually having that as like a shared services benefit, for example.
Yeah, that's a really good question. And basically, there's a variety of vendors working in different states. And in some states, a vendor like ELV might have a small partnership that we didn't highlight in that document, but maybe we didn't know about it or we need updated information. Or they're working, and this is applicable to any vendor. I'm just using ELV as an example. Or they're working with individual providers and not like a funded initiative. And so in that case, we're happy to quantify those efforts within the document. And I think that with regard to shared services or just quote unquote, like using software licenses to get providers engaged, it could depend on your funding source, like how much funding do you have, how many providers can you cover? And I know that some shared services organizations are adding the CCMS license fee that they negotiate into their membership benefits for shared services, specifically so there's not multiple fees that the provider's having to pay. And they are doing it in a highly transparent manner, but so the provider knows that that's included in the cost. And maybe there's a case where, someone uses CCMS and pays a fee, and then someone else does CCMS and the bigger shared services program and pays a different fee. I think a lot of that is like work in progress. And I don't think there's a definitive model for it at this point, but I don't know if that helped at all, but I appreciate the question.
Yeah, it does. It's definitely a different way of looking at it and different approach. I mean, right now we don't charge our shared service members any fees or anything. So kind of like the other individual was saying, it's not, we've been fortunate to not have to charge them, but maybe bringing something like this on board would then obviously you'd have to share that expense across the board as well. So in the ELV that we work with, they are out of Colorado.
Yep.
So maybe that's why it just shows like it doesn't show in Pennsylvania, but in Colorado it does show because I know like that's like where they're housed out
Yeah,
of.
that's where their headquarters is. And I think in that document, we were mainly focused on state contracts versus more regional contracts. But again, I'm happy to add that. If you want to reach out to me, I'll put my email in the chat box and I can get it added so that we can adequately represent that.
Okay, excellent. Thank you.
Yeah. Okay, thank you, everyone. Keep us posted if we can help anyway. We're more than happy to talk through any questions or challenges that you have. And again, we'll send out this recording as well as the slides from it. And of course, the toolkit itself is posted online, available 24/7 for your reading pleasure. So thank you again for joining, and I hope you have a great rest of your day.